Personally, HIV affected me from a personal level, where I lost so many relatives to HIV when I was in high school.
I'm interested in how I can track and identify infectious disease outbreaks.
This summer, I got the opportunity to work on an adolescent HIV intervention in Cape Town, South Africa.
I wanted to dig deeper. I wanted to be actually part of the story.
Somebody had to do something, like I wanted to make that change. I knew I have to do public health.
I was really interested in Brown because of their focus on learning public health by doing public health.
I like how there are many different research centers that allow different students to find what they're interested in, what they're passionate about.
One of the things that's different about Brown is we've got a lot of faculty and we don't have that many students. It's not that difficult to find a faculty member who's working in the area that corresponds to your interests.
So my first week here, my first class with Dr. Lurie, I asked him after class if I might be able to work with him, and he agreed. He's been helping me develop my research interest, and he's my thesis advisor now.
Brown was so open to allowing me to meld my work with my school experience. So it was going to make it possible for me to do both things at the same time.
What I love about Brown is the multidisciplinary, where it's not just one department. You can transfer and work with other members from other departments like epidemiology, biostatistics, health services.
I think there's several reasons that students choose to come to Brown. Of course, they love the idea of being able to design and to participate in the design of their own curriculum and their own experiences, learning by doing public health. And they have the whole university at Brown at their disposal to develop their skill sets and their knowledge base.
All of the professors are incredibly accessible, and a lot of them work in the field. So they're not just academics who have a conceptual understanding of public health, they're actually doing public health all the time. So they draw that experience into their lessons.
I think a central part of our philosophy is that students should be learning both in the classroom and in their hands-on experiences out in the real world.
And in the afternoons, I would get the opportunity to go out to local sites in the townships around Cape Town to see firsthand what all my learning in my classes was doing to have a positive impact on the people in Cape Town was something that was really fulfilling for me.
At Brown, we learn public health by doing public health.
I learn public health by doing public health.
I'm learning public health by doing public health.
We learn public health by doing public health.
I learn public health by doing public health.